While heroin deaths continue to spike on Long Island, the growing suburban addiction took 53 lives on Long Island last year, and already 36 deaths being reported this year. Police and prosecutors are trying to break the heroin connection to Long Island, but the supply continues, even with some reports that dealers are delivering the deadly drug right to users' homes. Joining us now, a father and son medical team who are working to treat heroin addicts on Long Island. Please welcome Dr. Simon Zysman, who is the CEO for EARS. That stands for the Employee Assistance Resource Services Organization, and his son, seated directly to my left, Warren Zysman, who is CEO of Addiction Care Interventions, and they provide chemical dependency services locally. And so let me begin with this, Dr. Zysman. Are you seeing an increase? How would you characterize the number of heroin cases you're dealing with now?
The number of cases have substantially increased. We started our program in 1986 when most of the patients were coming in with alcohol, marijuana, and cocaine-related issues, and now the predominant referrals tend to be opiates.
You know, it just seems like the drug changes, but the syndrome does not.
Well, the number's been growing steadily. We've never seen it decline. And as a result, we've been fortunate enough to be able to develop a treatment approach, which we refer to as ambulatory detox, where services are rendered on an outpatient basis using medication-assisted therapy.
And is that where you come in, Warren? I mean, explain how you treat people dealing with heroin addictions.
So we use a multi-pronged approach. We use medication-assisted treatment, psychotherapy, cognitive behavioral therapies, and we also use family therapy and case management.
Family therapy is a big part of it, isn't it?
It's a huge part. I mean, having family members who are actively involved in treatment, supports who are going to be involved at home, can really help to encourage people to utilize the skills that they're learning in treatment and maintain compliance with the services they're receiving.
Because as I said, you know, it seems like the drug changes. I mean, heroin actually was a scourge in the 50s and the 60s in this country, faded away, and then other things took its place, and now here it is again. So it's really more about what drives people to addiction. What do you think is driving this spike in heroin addiction?
Well, I think the biggest driving force is the use of oxycodone for pain management. Oxycodone is being very widely prescribed, and it's being abused by many people, including people's children. And so the face of what people would typically think of as a heroin addict has changed, and it's kind of gone through all socioeconomic groups here in Long Island. It's devastating some of the middle class and upper middle class communities here.
So that's the suburban profile of this drug addiction. So, you know, why are the suburbs proving so prone to this, Dr. Zysman?
Well, one of the problems is patients were relying on oxycodone, Percocets, and so on, and now it's less readily available, and it's more closely monitored, and as a result, many of them are turning to the street and they're purchasing a drug like heroin in order
Which is actually cheaper than the Oxycontin, I understand,
yes,
because of the rise in price of trying to get it illegally on the street because of the crackdown on doctors prescribing it.
Well, many of them refer to it as a poor man's pain medication.
How serious is a heroin addiction? It can kill you, we all know that. Is it one of the toughest to shake?
It is one of the more difficult ones because when it comes to opiate addiction, the withdrawal process takes about 6 weeks in terms of the physical withdrawal once the drug has left the system. And then it takes a while for the psychological component to be addressed as well.
Which is why people try to resist treatment many times. If you're working, providing for a family, or you're in that kind of situation, you're thinking you don't have 6 weeks of your life to give away and then the months that may follow for recovery. But of course the alternative could be death. Now, I understand there's a new drug that's been approved for treatment. What can you tell us about that?
So one of the medications that's being utilized in our outpatient treatment centers is a medication called Suboxone. And Suboxone is an opiate with an agonist, so it blocks 86 of the 88 receptors in the brain.
So it's been successful.
It's been very successful. Within 24 hours of people starting this medication, they can return to work, school, and we're utilizing it with both adolescents as well as adults.
Well, you know, it's part of the human condition. We've been facing this issue for thousands of years of using substances to alter the way we feel about it. And yet, you know, one of the things that I've seen evolved is that you try to get people to understand that, you know, you got hooked, you have a problem. It isn't, you know, you don't have to take all the guilt in the world. What do you tell a person who's sitting listening to this right now who has a heroin addiction? What should they do? How do they get themselves right?
Well, one of the ways of doing it, they come to our office, we do the intake, we diagnose the problem, and we give them instructions exactly as to what they need to do. For example, before they could start taking a medicine such as a buprenorphine, which is Suboxone or Subutex, they need to be drug-free for a minimum of 24 hours in order for the medicine to be effective. If it's taken sooner than that, what happens is it'll actually accelerate the withdrawals and make them sicker.
Yeah, so then this is why we need professionals like yourselves and others who are working on this continuous problem. Thank you for joining us today, Dr. Simon Zysman, his son Warren Zysman, for your insight on this problem that continues.